Welcome. My name is Dr. Dan Tomaszewski, and I'm an orthopedic surgeon at the Bone and Joint Center of Door County. And I'm here today to talk to you about hip replacement surgery. Hip replacements are one of the greatest surgical advances in modern medicine. Hip replacements have been around for decades, and they're very successful surgery. Now, you're here for this class because you're interested or may have considered going forward with hip or knee replacement. I'm going to talk to you about the specifics of what hip replacement involves and some of the risks, the benefits, and the rehab of the surgery. When you make the decision to go forward with a hip replacement, it's a life-changing event, and you'd like to make sure that you have all the knowledge that you can before you make the decision to go forward with hip replacement. Hip replacement involves fixing an arthritic problem. What we do is we remove an arthritic ball and an arthritic socket. In its place, we put in a new ball, a new socket that looks much like this. If I take this apart, we can show you what the joint itself looks like. The ball is attached to this stem that goes inside the femur bone. And the socket is a new socket that we make and place inside your own native bone. So rather than bone grinding on bone, we have metal or ceramic against plastic. This is a new bearing surface. This is not what you were born with, but rather something that's much more comfortable. Unlike the hip that you're born with, there are some differences. This is a mechanical structure. And with that, there can be some risks and some challenges with hip replacement surgery. And I tell the people about 6 or 7 risks that they should be aware of before they consider going through this surgery. The first thing I talk to folks about is infection. Anytime you go through any surgery, you should be aware of the risk of infection. Any surgery that you have, you can get an infection, whether that's a toenail surgery, a heart surgery, or hip replacement surgery. An infection around a hip replacement is a life-changing event. It's a big deal. It means long-term antibiotics and more surgery. But fortunately, it's very rare. And we do everything we can here to try to prevent that. Whether that be antibiotics beforehand, or preoperative prep, or antibiotics afterward. Still, infections can happen. And they can happen the day after surgery. They can happen 10 years after surgery. And you always have to be vigilant for them. Next, I talk to people about bleeding. It's possible to lose enough blood to need a transfusion after surgery. It's a pretty uncommon but not unheard of complication of hip replacement surgery. Next, I talk to people about the sciatic nerve. The sciatic nerve has to actually be moved and protected during the surgery to do it safely. Occasionally, very rarely, fortunately, that nerve can go numb, or you can get weakness after the surgery because of that. Again, it's a very rare complication or problem. Blood clots can happen after surgery. For 6 weeks after surgery, we put patients on blood thinners, and that may be a prescription strength blood thinner or just aspirin. And we make that determination based on your risk profile. People who smoke or have a personal or family history of blood clots may be at higher risk for blood clots. Lastly, I like to talk to people about mechanical issues with the hip. Again, I told you hip replacement is not what you were born with. These are mechanical parts that replace the biology that went wrong in you. The hip that you were born with has a ligament that connects the ball to the socket. That prevents that hip from ever wanting to pop out. That ligament, unfortunately, has to be removed when we do the surgery. And what holds the hip in place after that happens are the muscles around the hip. If your muscles are weak, or if you get yourself into the wrong position, that hip can pop out. We call that a dislocation. And that's a very rare but possible complication or side effect of surgery. One of the things that we can do in the operating room to try to prevent that problem is actually lengthen the leg a bit. If we lengthen the leg just a bit, we can put a bit more tension on the muscles that hold the ball into the socket. With that, the leg is a little bit longer, but it decreases your chance of dislocation. And I tell folks every day I would rather take a slightly longer leg to avoid the possibility of a dislocation. Still, both issues, limb length inequality or dislocation, are a possibility. Finally, I talk to people about the risks of anesthesia. And anytime you go under anesthesia, there are risks. Heart attacks, strokes, death, all those things are possible. Today, we almost always use a regional anesthetic, which really limits the chances of those problems. But you need to be aware of that possibility anytime you go under anesthesia. So I've covered the risks. Now I want to talk to you a little bit about the rehab. Hip replacement surgery hurts. There's no doubt about it. Now many times people will tell me immediately after surgery, even in recovery, my hip feels different. It feels better. It's a different type of pain that you experience after surgery. It's a pain from the muscles and not from the joint itself. And that can be difficult. Those muscles are sore for quite a while. And it can take rehab and time and medications to help with the pain. One of the things that makes hip replacement so much better than it was even 5 years ago are the medications that we use that can help people get through the difficult times of when it's the most sore and most swollen. It used to be that hip replacement involved a 3 or 4 day hospital stay and IV pain medications and a prolonged recovery. Today we know that the faster we get you back home, the better you're going to do with your hip replacement and the lower the chances of risk like infection and blood clot. So we do everything that we can to get you prepared for surgery and to help you through that early postoperative course. Some of that has to do with this presentation today. Our joint class helps you understand exactly what to expect. But a lot of it has to do with the anesthesia that we use and the medications that we use and the physical therapy that we use to help you through that early hospital course. There are a number of different medications that help with our swelling and help with the pain, but you have to be aware that there is pain and you have to be able to go through the rehab. After surgery, there's restriction on you in terms of the position that you can put your hip into. Certain positions can put the hip at higher risk for dislocation. And we limit your positioning after your hip replacement to try to prevent that complication. You have to be willing to abide by our hip precautions, which our therapists will tell you more about. Again, hip replacement is a very successful surgery. And fortunately, 93 to 95% of people have a great result. But you have to be willing to accept the risk and you have to understand the rehab associated with the surgery. I want to thank you all again for coming, and I want to let you know that it is my privilege to work with Dr. Davis and help lead this team of world-class physical therapists, nurses, and associated healthcare providers to help provide you with excellent care of your bones and joints. It is our privilege to work with our friends and neighbors and to help them through what can be at very times a difficult problem. And if there's anything that I can do to help make your experience better, I want to be there for you. Thank you for your time and your attention.